We will have our fun with Mayor Tory when he joins Gina back over there in just a second. But let's get to some of the news, some major developments in our battle against COVID-19. The big news being Health Canada approving the vaccine, and the first shipment is expected to arrive on soil on Monday, on our Canadian soil. But how's it going to be distributed on a municipal level? Joining us now is Mayor John Tory. Good morning to you.
Good morning, Mel.
Okay, so definitely some positive news. I just want to get your initial reaction with the approval from Health Canada and what this means for Canadians, Ontarians, Torontonians.
Well, how can it be other than a great day? But I think the most important thing for Torontonians is that this means that our best experts, our best scientists that look after approving every drug that comes onto the market for them has said this vaccine is safe. Because I think that's a very, very important message for people to focus on. We're going to be encouraging people to get the vaccination because it's going to help protect their own health and the health of others. But they'll want to know that it's safe. And I think Health Canada, who does such a great job for us, in addition to the health authorities in the UK and soon to be others, I'm sure, have said that it's safe. And I think that's the most joyous part of the day because it puts us at the beginning of a process now to try to move on from the pandemic, knowing we still have lots of work to do.
Let's talk about that rollout. Obviously, at a municipal level, it's a lot of the logistics. So have you been talking about what those logistics look like, and has more been developed over the last couple weeks, because it's been moving very fast, it's been expedited, on what that could look like?
It's been amazing how fast it has worked. Quite a few weeks ago, I asked that a task force be set up under the leadership of our Chief Peg, our fire chief, but who's been moonlighting very capably as the person that's been dealing with logistical matters. That's an understatement, but during the course of the pandemic all the way through. And he has been in extensive contact with the province. And let's just say this, in the early stages, I mean, we will, the division of responsibilities, and it's oversimplifying it a bit, is that the federal government obtains and distributes to the provinces the vaccines. The province sets the rules with respect to sort of the priority with which people get it, different groups of people, and the city then helps with the actual, I call it the retail end, but the actual delivery of the injections through Toronto Public Health. The first stages, which are going to go mainly to long-term care homes and people like that, I don't think the municipality, the city, will have as much of a role, but we'll stand by and provide whatever help we can to the province based on their decisions. They're in charge of that part of it. I think in the later stages where we get into vaccinating the population, we will be deeply involved. So the work we've been doing is to find places, which we've done in order to do this, to deal with the logistics, as you properly call it, of getting the vaccine from one place to another, hiring the people that are going to have to actually give the vaccinations, because you're not going to want people right off the street to put that needle in your arm, and so on. And so it's a big job. It's a job that will intensify as time goes on. And I can just tell you that Chief Peg and his team and all of us are, working very hard to make sure that we're ready when our stage of activity comes at the request of the province.
No doubt a big task ahead. Let's talk about where we are right now. Toronto been in lockdown for a couple of weeks. How are we doing, and are you anticipating that this lockdown will be extended?
Well, we're when you say how are we doing, this is a difficult thing to know because you don't know what would have happened had we not done the lockdown. I think if you look at our case count, even though it's still very disturbing relative to many other places, I heard the Premier talking, for example, about the state of Illinois versus the state of Ontario. And Illinois has about, I think, 20 million people, and they have 10,000 cases on a daily basis. We have 14 million people and it's 12 million people in Illinois. We have 14 million people and have 1,500 cases. So I think, if you look at Toronto and other cities, we're doing all right, but I think there's still lots of room for concern and lots of reason why people should adopt even more discipline than ever with respect to their own behavior, mainly involving staying home and staying out of circulation with other people. So with respect to the lockdown, I guess all I have said is that I think whatever it is that we're going to do, we should make sure we give people some notice and not wait until the night before, because I think if there's going to be a reopening at the end of the lockdown, then businesses need to know that so they can disinfect, so they can get their staff and so on. If there isn't, then I think people need to know why that is and what the plans are, just so that we can give notice. So I think those discussions are going on. You can be sure we talk every day back and forth between the province, which put this lockdown into place with our support, and the city government and the public health officials. They're all talking every day to sort of see how things are going. And there are some promising indications, but there's still big problems out there.
A lot to talk about in the transit file. We are seeing ridership. It's been changing, obviously, over the last few months. Bus ridership, though, is sitting in, I believe, in the window of 40 to 45% and reallocating some of those routes and seeing where the need is greatest. Can we talk a little bit about what's next with it? Because people are sort of getting into some types of behaviors where they are getting back on some of those buses on certain routes. Drivers are being rehired back. What is the future of transit right now? Because obviously there's a lot of money being lost.
Well, let's focus. Yes, there is a lot of money being lost just because people aren't riding the transit. The total ridership is still hovering in the neighborhood of about 30%. So you can imagine that means there are 70% of people who aren't using the transit system on all its modes, subway, streetcar, bus, and so on. But we're providing basically very close to a full service, notwithstanding the ridership is so much lower, because we believe that there are so many people who have to get to work and they just need to be on the transit, whether it's 30%, 50%, or any other number. What we have done, because there are places where the bus traffic is the traffic on the bus, passenger traffic is up, upwards closer to 50%, in the 40s somewhere, is reallocate people. We've hired back every operator. There's nobody on layoff anymore. They're all hired back. But even that doesn't give us enough bus drivers to do what we need to do, which is to add extra buses on those places like Jane and Steeles and Finch, where the bus traffic is very heavy. And so we've reallocated buses from other parts of the city, and we've even taken now some subway and streetcar operators where things aren't as busy, and we are retraining them to be bus drivers. So I think it's fair to say that we're doing, the Transit Commission under the leadership of Rick Leary is doing everything that can reasonably be expected to be done to supplement that bus availability in the areas where it's been really busy, and to do that in a way, in some cases, where we make very minor adjustments to places where it's not as busy, like, say, the downtown routes. There just aren't as many people downtown, so as a result, we can make some adjustments to the downtown bus service and use those extra buses and people to serve places that are busier.
I want to get your take on education. Obviously, in Thorncliffe Park, we are seeing 3 schools that are closed right now amid outbreaks. And there are a lot of teachers calling for asymptomatic testing at every school within the TDSB. An open letter written to the province and Toronto Public Health, as well as the chair, Alexander Brown, who we had on the show earlier, that said it's not up to him. They're going to take the lead from Public Health. What do you think about potentially extending that holiday closure a couple weeks so that we can get things under control so there isn't a spread of infection, but also asymptomatic testing everywhere within these school systems?
Well, I'm not a doctor or scientist either, and I'm no longer a parent of school-age kids. I'm a grandfather of kids that are in school, and I know for parents they would rather, and for the kids, for the benefit of the kids, we've been trying, everything we've been doing has been trying to keep the schools open, and I think actually it's gone quite well. If you look at the hundreds of schools we have in the city of Toronto and the relatively small number that have been affected by anything material in terms of an outbreak, it's gone quite well. Having said all that, I want to be consistent. A few weeks ago when this idea was first floated, I thought that it wasn't maybe a bad idea, given that you have to assume there are going to be people who will not necessarily follow all the rules, even if they should, over the course of the Christmas break. And therefore, you could kind of, keep any virus that may have found its way into households out of the school system. I heard an idea being articulated this morning that maybe not bad, which is to say, well, look, maybe you take a week now to give that extra chance to kind of keep things clean in the school system and add it on to the school year at the end of the year. Maybe the teachers should be offering that up, and they might find there's more response to it. But look, it's not my decision either. Just like the chair of the school board said, it'll be ultimately, I think, a provincial decision, and the health people will weigh in on this. I don't automatically reject it as an idea, but I know it causes a lot of heartache for parents if it happens. But I think what we want to do is best for health, and the health experts will tell us what to do.
Yeah, a lot of things to look at there. As always, Mayor Tory, we appreciate your time. I may be sorry for what's next. We're not sure. Dina's got a surprise for you. It's going to be good.